Sarvebhyo Gurubhyo Namaha. My name is Vakyartha. I am a practitioner. After completing my UG in 2020, I have been practicing Ayurveda. So today's my chapter is Tadvidyab, and in this chapter, my favorite topic, being a practitioner, is the Chikitsa part. So if you ask me the question, please. What do you find therapy of this? Practice also. Okay. So, firstly, whenever I started practicing, I saw that most of the patients were having Ajirna Ahara Lakshanas, but they didn't know about it because they did not have most of the Ajirna Ahara Lakshanas like Udgara Shuddhi, they did not consider. Utsaha was there, but it was hidden or it was not there, that we do not know about them. And Yathochita Vaikotsarga was not there because either they were doing Vegam or because of the lifestyle they used to do Vegatharana. So Yathochita Vega Utsarga was not there. And Shuddhi Pasa at the right time was also not there. Or even if it was there, it was again Vegatharana or Udirana of the both of these Shuddh and Vipasa was also done. So considering all of these, Ama was always there in all the patients or most of the patients that I saw. So even when I practiced, the first time of treatment for the first 3 to 5 days, I always put them on Apapachaka, depending on their Bala, depending on the Kala, and depending on the cost of the person, and also Vyati in some cases. Most of the cases we need not ask because we know that they will not take Mantra or Kashmara. Yes. So when we ask them, what is your, will you feel hunger or not? So here, Mantra Kamara, Lakshanas of Mantra Kamara is when they take it in the morning. He says here, Sayam Prakashta Jivni. So in the morning, whatever he is taken, it should be digested by the evening. So when we ask them if do you feel hunger when you are eating, when you want to eat? Like you need to say about the Veda, Sara. Yeah. So here, yeah, so Kukshay, all of these things has to be examined.
How will you assess the Hina Matra in clinical practice?
About Hina Matra.
Hina Matra.
Okay, so when we ask the question of do you feel hunger, first thing, and when we ask the patient about their weight loss or weight gain patterns, we will be able to understand if they are eating Hina Matra Ahara, and also we will be able to understand if the patient does not have Vikara properly just before feeling hunger. Say if he has had the food in the morning breakfast, by afternoon if he is feeling Udgara Shuddhi, that is when we understand it is Mantra. And if he is feeling Udgara Shuddhi earlier itself, then we can consider it as Hina Matra Ahara.
Slok number 6.
Yes.
Sentence Sayam Prakashya Sukhena Parinamanam. My question is, what is the article of this sutra and what is the meaning of this sutra? What is adhikara? And what is meaning?
So the meaning I tell first. Sayam pratascha sukhena parinamanam. This explains that whatever the food has been taken in the morning should get digested by evening, and whatever is taken in the evening, by next morning it has to get digested. And the reason why he is telling here is to explain us about the ahara sevana kala, that only 2 ahara sevana kala is advised.
There is one statement that we have to reserve one amsha for doshas.
Yes.
What does it mean?
It means here in the Tika he says, Tena dvau avakasho aharasya vaktavyo ekastu doshanamiti tiritham vakshyamana. That is what sir said now. Doshavakasha sthapanam hi ahara upakarakatvat aharasya ityuchyate. दोषावकाश अनवस्थाने हि आहारो दोषैः दूष्यते इति वक्तव्यम्. Which means
Find any clinical cases like this. Patients.
okay. Yes, sir. There are conditions when they say that they would have had the food atanta purti. If I can use some Kannada words also. Purti mutte brioche tinbuttirtini anta ಹೇಳ್ತಾರೆ. This is the very specific word that they say. So
This I want to connect to the previous marathon session that happened.
yes, sir.
That was on Agni.
Yes.
You will find one of the easy outcome of this is various events like the gastroesophageal reflex, like the possibilities of hypertension.
Yes.
In all cases, this is an outcome of chronic event of not keeping any amsha for doshas.
Yes, sir. Correct.
Difference between Ashitam and Khaditam.
Ashitam is what we chew and eat, and khaditam is what can be just swallowed, like kind of porridge thing, which we need not chew, but is in that semi-liquid form.
Could you suggest when you for in the context of Ajirna, would you suggest that any specific things have to be making it like Ashitam, Khaditam, Pitam, Leadam in clinical practice? How relevant is it?
So, first of all, we would say that whatever the food has to be taken in Ajirna cases has to be always light. That is what is generally practiced. So, I would advise them to take Ashita only, but in very limited quantity, so that it is not giving Saurithya. Ati Saurithya is not happening. Like they are not overeating the quantity. It should be only very minimal, Laghu Ahara in minimal quantity, because the food has to be chewed and only eaten. That is where Ajirna will not happen further. So I would advise them to take Ashita only and not Khadita, not anything that can be drinking like porridge or anything. I would say they tell them to have solid food. Pitam, Drava means maybe it could be Ushna Drava only and nothing more. Yes, ma'am. Yes, ma'am. So, yes, ma'am, because in that condition there is no Ajirna in that condition. There is no Ajirna after Samshodhana. Yes, ma'am. Okay. 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 I understand.
Thank you, Sushma Devi. Now I call upon Dr. Pallavi Hegde, who will be presenting on Maharoga Adhyaya. Next, I request Dr. Sushmita